The Ebola outbreak in West Africa in 2014. The Ebola outbreak in West Africa in 2014 was one of the worst epidemics of the disease in history. The outbreak began in December 2013 in Guinea and quickly spread to neighboring countries, including Liberia and Sierra Leone. By the time the World Health Organization (WHO) declared the outbreak over in 2016, more than 28,000 people had been infected and over 11,000 had died. The outbreak began in the forested region of Guinea, where the first cases were reported in December 2013. The disease was initially misdiagnosed as cholera or malaria, and it was not until March 2014 that the WHO confirmed that the outbreak was caused by the Ebola virus. The virus quickly spread to neighboring countries, with cases reported in Liberia and Sierra Leone in March 2014. The disease spread rapidly in these countries, where weak healthcare systems and a lack of awareness about the disease made it difficult to contain the outbreak. The Ebola virus is transmitted through contact with the bodily fluids of an infected person, such as blood, sweat, semen, breast milk, urine, feces, vomit, semen, and breast milk. Healthcare workers, family members, and those who come in contact with the bodies of the deceased are at a higher risk of contracting the disease. The symptoms of Ebola include fever, headache, muscle pain, weakness, fatigue, diarrhea, vomiting, stomach pain, and unexplained hemorrhage. The symptoms can appear between 2 to 21 days after exposure to the virus, but usually appear within 8 to 10 days. As the outbreak spread, it overwhelmed the healthcare systems of the affected countries, leading to a shortage of hospital beds, medical supplies, and healthcare workers. The international community, including the WHO, the U.S. Centers for Disease Control and Prevention, CDC, and Copyright des Sans Frontières d'Irrécessories, MSF, intervened to help contain the outbreak. International efforts included providing medical supplies and equipment, training healthcare workers, and building treatment centers. However, the response was hampered by a lack of resources and by a lack of experience dealing with the disease. The outbreak also had a significant impact on the economies of the affected countries, as trade and travel were disrupted and many businesses were forced to close. The outbreak also led to a decline in agricultural production, which further exacerbated the economic impact. The outbreak also had a significant impact on the population, as many people were forced to flee their homes, and communities were torn apart by the disease. The outbreak also led to a decline in trust in government and healthcare institutions, as well as an increase in stigmatization and discrimination against those who had been infected or affected by the disease. The outbreak was eventually brought under control through a coordinated international response and effective measures to contain the spread of the disease. The WHO declared the end of the outbreak in Guinea in December 2015 and in Liberia in January 2016. Sierra Leone was declared Ebola-free in March 2016. In conclusion, the Ebola outbreak in West Africa in 2014 was one of the worst epidemics of the disease in history. The outbreak began in Guinea in December 2013 and quickly spread to neighboring countries, including Liberia and Sierra Leone. By the time the WHO declared the outbreak over in 2016, more than 28,000 people had been infected and over 11,000 had died. The outbreak had a significant impact on the health systems and economies of the affected countries, as well as on the population. The international community intervened to help contain the outbreak, but the response was hampered by a lack of resources and experience dealing with the disease. The outbreak ultimately brought under control through a coordinated international response and effective measures to contain the spread of the disease.